Hello, you guys may all be wondering why I have brought you here today. I brought you here today to discuss about evaluating health communication programs to enhance healthcare and health promotion. So, health communication programs are essential and universal parts of delivery of healthcare and the promotion of public health. What is public health, you may be asking? Public health involves the well-being of entire communities. Public health professionals are concerned with maintaining the good health of the entire population. Through education, they do this through education, community partnerships, health campaigns, immunizations, and other medical care by maintaining healthy standards. So, health communication programs are used to provide basic health information, warnings about health risk, guidelines for delivering self-care, education about diseases and therapies, feedback about changing health conditions, updates about medical test results, strategies for breaking negative health habits and adopting healthy behaviors, and support for making complex health decisions. Health communication programs use a range of communication channels, including like posters, instructional handouts, or pamphlets, and they use professional counseling and health education interactions, health information, websites, public service announcements, online patient and caregiver support groups, tailored health information systems, webinar-based tutorials, entertainment educational programs, telehealth systems, interactive patient-centered health records, communication programs, and the list goes on. These are all ways to promote healthier lifestyles. So, while the health communication programs have proliferated, we are not always well informed about the influences these programs have on the audiences they are designed to help. So, I have come to discuss some ways to come up with an evaluation to change this. So, some health communication programs can evoke unintended and even negative responses from diverse audiences. It is critically important to conduct regular, ongoing, and strategic evaluations of health communication intervention programs to guide development, refinement, and strategic planning. So, basically, I am saying that I'm going to describe a way for an evaluation program to make these programs more beneficial than non-beneficial. So, the goals of an evaluation research. Evaluation research programs are essential for increasing understanding about how well health communication intervention programs work. Failure to engage in careful and concentrated evaluation research is likely to doom the success of the health communication interventions. Evaluation research can answer important questions about the specific influences health communication programs are having on different audiences, and identifying who is paying attention and what is being learned from these programs. So, evaluation data will tell us whether health communication programs are having any unintended influences, including the boomerang effect or or any other negative effects that they could be having on communication. And so some communication programs have had negative influences on key audiences, such as the National Youth Anti-Drug Media Campaign, which actually increased interest in using illegal drugs by at-risk youth, which is not what they intended to do. Evaluation research can help explain why some programs work and what parts of these programs work, and what programs work best, like what parts work best. So the reason why we need this, why we need evaluation of data. So the ultimate goal for evaluation research is to guide improvements in health communication programs to enhance health promotion. Gathering good evaluation data can be similar to turning on the lights in the dark room. Oh, now I can see. It is very different. It is very difficult to design complex health communication interventions to work well intentionally. So, good evaluation data will identify problems with health communication intervention strategies and suggest directions for refining these strategies. Evaluation data can help guide design interventions to meet the unique needs for the different audiences that they're trying to target. While collecting evaluation data from key audiences, representatives, health communication experts can begin to build collaborative relationship with these representatives to invite them to assist with user-centered design of health communication programs and to engage in the community participative research and intervention program development. So, good evaluation research can explain the cost and benefits of intervention programs to determine whether the outcomes received from these interventions are worth the time and expenses invested in them. Clearly, data gathered can clearly suggest the benefits of the intervention are greater than their cost. These data can be used to justify larger long-term investments in these programs that can lead to sustaining and institutionalizing the best programs within the communities. Gathered evaluation data speaks loudly and can help researchers advocate for needed support to expand programs for their health promotion. So, that brings us to the nature of the evaluation research. So, good evaluation research is disciplined and it's carefully planned and it's very careful. So some good evaluation data provides health communication program planners with critically important information about the following: level of demand for health communication programs and the issue they cover, environmental constraints and specifications for the implementation of communication programs, specific design flaws and limitations of the communication programs, user assessment of efficiency and effectiveness of communication programs, the appropriate fit for these programs with specific audiences and context, strategies for adapting communication program to fit the unique demands of users. So, we need all of our research to be valid, so this is an important development that is best evaluation research designs and methods to inform health communication program designs and refinements. Poorly conducted research is worse than no research at all. Invalid evaluation research will mislead communication planners about the needs for the directions of changes to the communication programs. So this brings us to two primary forms of concern in evaluation research. We have the first, internal validity, concerns the accuracy of conclusions drawn from evaluation research. Is the study conducted in such a way that it misleads the accurate findings about the communication programs being studied? External validity concerns the general ability of the findings from evaluation research studies. So, can the conclusion from the study be applied to other people, programs, places, or times? The primary concern about internal validity is the poorly conducted research with low levels of internal validity would result in false and misleading evaluation results. So, to promote internal validity, evaluation research should take care to increase the rigor over the ways the research is conducted to ensure that variables are personalized to promote measurements validity and reliability, to make sure that the research participant responses are not based by their experiences with the research, like are they biased, history, selection, or any demand effects from the research, and to make sure that their own personal attributes, goals, and observational biases as a researcher do not influence the research findings. And so to promote external validity in evaluation research, researchers must take care to ensure the sampling strategies they use are representative as possible to the populations they want to generalize findings to, that the research methods have ecologically validated and are realistic to real life settings they want to generalize findings to, and that studies can be replicated with different subjects and settings to validate the generalizability of the results. So there are two types of evaluation researches, and those are formative and summative evaluation researches. So what is formative evaluation? Well, it's just essentially the process in the development and refinement of health communication intervention programs. And summative, hold on, let me go back to the formative. So this research is used to test the adequacy of current programs for providing relevant data for improving the programs. So you may ask, what is the nature of the health problem that needs to be addressed by the communication interventions? How complex and interactable are these problems? Formative research also helps to identify and segment the key audiences that need to be reached to address the specific health problems. So the summative evaluation research is used to measure overall intervention program influences and outcomes. So this research documents the positive and negative influence of health communication intervention programs. So the summative data should examine overall patterns of program use, user satisfaction with programs, messages, exposure, and retention from the programs, changes in the key outcome variables, such as learning, relevant health behaviors, health service utilized, and health status, related to the intervention, as well as economical analysis of the program's cost and benefits. And so the formative and summative evaluation research should not be viewed as separate and unrelated intervention research process. Rather, they are viewed as different parts of an evaluation research continuum. So you need both of them. So that brings me down to the audience analysis research, which is critically important part of the evaluation research. It is a necessary prerequisite to creating and refining health communication programs that are responsive to the concerns and needs and perspectives and communication styles of targeted audiences of the people that communicators want to reach with messages. Intervention programs that are designed on the basis of rigorous audience analysis data are likely to be seen by key audience members as a personal, relevant, be attended to, comprehend, carefully consider, and accepted, because these programs are developed with audience members' concerns and expectations in mind. Needs analysis are initial applications of audience analysis research that gathered data from potential program users to establish levels of program demand and opportunities to design the unique intervention programs to fit audiences' specific health needs. So not just the specific health, like the specific people, but the health needs that they're concerned with. So after the needs are analyzed, or after the needs analysis is conducted, it is time to get to know the unique factors of the individual's health communication interventionist wants to reach. So the key audience analysis data that should be collected include demographics, like the age, gender, race, ethnicity, education, income, current and past related health behaviors, communication characteristics such as like the media, which use of patterns, media preferences, literacy levels, and language preferences, audience members' knowledge, attitudes, values, and emotions related to the intervention topics, their cultural habits and preferences, effective motivational factors, and potential barriers to accepting the information and change in health behaviors. So, all health communication and intervention programs should be based upon clear evidence of what works and what is not working very well. There is a wealth of important data, often lying dormant in every healthcare promotional setting, that indicates what has and what has not worked in the past to achieve health promotional goals. There are two general strategies for collecting audience analysis data, and the evaluation researcher can review existing data about key audiences such as the federal, state, and local health statistics, and extent research literature about target audiences, or conducted secondary analysis of previous collected data from target audiences. So the evidence-based interventional efforts is the best intervention programs are based upon strong evaluation data. Strong evaluation data should provide clear evidence about what has and has not worked in the past to promote health. These data should help demonstrate the need for change and intervention within the healthcare system. These data should help identify the kind of health communication intervention programs that will best fit the needs of the specific audience and fit within the constraints of special social context and environments. So basically it's saying what I've said already, like you need to fit your audience, not like just one person. You've got to try to think of like everybody's health needs. So the methodology or the methodological issues in the evaluation research, there is a number of factors that often limit the effectiveness. So it's important to determine how health communication programs are accepted and utilized over time. Another common problem is ways that evaluation research is conducted involves over-reliance or self-report data. Self-report data are important are information requested from respondents, typically through the use of survey tools such as interviews, focus group discussions, and questionnaires. In too many cases, self-report data has become the default research tool for gathering evaluation data. While self-reports often provide interesting data, they can also be biased, especially in organizational contexts, such as like the healthcare centers and clinics. where there may be social political pressures that influence their responses. So those may not always be completely true. So too often, evaluation researchers focus on tangible variables, and the variables that are tangible variables are just variables that are not directly relevant to evaluating health communication programs. There is a tendency for researchers to use existing research tools and standardized scales that they are familiar with and have already been validates, but they may not measure variables of different or direct relevance to the programs being evaluated. So a final common methodology problem with evaluation research to be addressed here that has already been alluded to the discussion of passive and active response mechanism earlier, but it's the over-reliance on shallow data in evaluation studies. A common example of shallow data is the number of data in, or like the number of data of web hits. It's difficult to determine what the number of hits means when evaluating a communication program. Does a lot of hits means it's a good program, or who is accessing the website? What are they doing at the website? Are they able to use the information on the website to achieve the health promotional goals? Is it unclear? Conclusions made on the basis of shallow data are often unwarranted. So, clarity is very important in the evaluation research data, and it's too often evaluation data are reported in complex and equivocal ways that limit understanding and application. This only increases information overload rather than increasing understanding. So giving them too much information just causes them to not even learn anything. They don't understand it. So the best practices for conducting evaluation research is use of longitudinal research. You need to use longitudinal research designs. This will help capture variations in programs and it will help to provide a clearer picture of health communication program strengths and weaknesses. It is important to gather evaluation data at multiple points in time to capture the evolution of program adoption and utilization. This means conducting surveys, observations, the textual analysis of different intervals, as well as to use the pre-post experimental design that compared outcome measurements at different points of time beyond the baseline measurements. And it's always best to establish a baseline measure before implementation of the health communication interventional programs. The use of multi-method research designs will provide evaluation researchers with a full assessment of health communication intervention programs rather than one or the other. So with this, you're combining the quantitative and qualitative data, and that can enrich the evaluation research efforts. While quantitative data can be powerful, analyzed statistically, and appears to carry strong scientific weight and objectively, they often fail to provide great depth of information and explanation about why users react to programs the way that they do. Alternatively, qualitative data, while sometimes appearing rather impressionable, typically provides great depth of information. When reporting in narrative form, qualitative data can be the most compelling. The combination of quantitative and qualitative data gives evaluation research both precision and depth of the analysis, instead of just one or the other. It is important to build careful operationalizations and measurements of key economic and health outcome variables in evaluation research of health communication intervention programs. By measuring relevant health outcome variables, evaluation research can access the influences of health communication programs on important health consequences, such as the user knowledge, attitudes, values, behaviors, health states, including levels of morbidity and mortality. Economic analysis of the costs and benefits of health intervention can clearly illustrate the relative value of these programs. It is imperative for evaluation researchers to use strong evaluation data to demonstrate progress and guide future health communication and interventions efforts. Good evaluation research efforts should provide clear information about the contributions of health communication intervention programs on the accomplishments of important health promotional goals and outcomes. By carefully tracking the progress, evaluation researchers can identify the achievements and shortfalls of health communication interventional programs. So, building this evaluation research into every communication program should be indispensable part of development and refinement of every health communication intervention program. Evaluation researchers should identify availability sources of audiences analysis data. What do we already know about the key audiences? Are there natural sources of information about key events that can inform evaluation efforts, such as medical billing records, public records, or message transcripts? Program developers should build a user response mechanism into every healthcare communication intervention program to provide feedback about the program use. Researchers should seek existing or established baseline measures of key audiences, attributes, and behaviors to use a benchmark for later comparison after use of health communication program. Usability tests should be conducted regularly to determine the effectiveness of communication programs to the different groups of users. Researchers should work closely with key representatives from target audiences to conduct user-centered design and community participative evaluation research. Data from evaluation research should be applied to refining and improving the healthcare communication program. So, this is very important. We really need to work hard on evaluating these programs, and the ones that don't work we need to not use, and the ones that work we need to use. And like I said before, sometimes we target the wrong audiences, or it has the boomerang effect, and that's something that we need to know, we need to look into and fix, and we can't do that without an evaluation. And so, just like anything else, these programs need evaluated, and it needs to happen now. And these are the ways to go about it. Thank you.